Good afternoon, everybody, and a very warm welcome to the latest in our webinars. Thank you for taking time at this time of crisis to connect with us. We're doing a number of webinars of this nature to try and bring together our clients, communities and colleagues, and to give you the opportunity to ask questions and get updates on the legal ramifications of the COVID-19 crisis. So I'd like to start by introducing the panel today. My name is Kirsty Eyre. I am a partner in the employment team at Irwin Mitchell. And joining me today on the panel are Emma Windle, who is a senior associate in our regulatory criminal group, and she's a specialist in health and safety law, and also Paul Kent, a senior health and safety consultant with Stallard Kane. Before we get into the webinar itself, I'd like to just raise a few housekeeping points. Thank you to those who have already submitted questions, which we will answer during the course of the webinar. If you would like to ask questions during the course of the seminar, please submit them via the Q&A function on your screen, and we will answer them at the end. We will be recording this virtual event and will send the recording out to you afterwards. What I'm going to do now is to start talking briefly about some of the employment law implications of exiting from lockdown and bringing staff back to work, which is something that a lot of our clients are looking at the moment. Now, one of the first questions that a lot of employers are asking us are, can staff refuse to return to work if they are concerned about their health and safety and about the risk of catching COVID-19 if they have to travel on public transport to work or from the workplace itself? Well, potentially, yes, staff can refuse to work, but only if they have a reasonable belief that their workplace poses a serious and imminent threat to their health. What does that mean? Well, the Employment Rights Act gives employees protection against being dismissed and subjected to any detriment, such as withholding pay or disciplinary action, if they exercise their right to leave the workplace or they refuse to come into work because they have a reasonable belief that their workplace poses a serious and imminent threat either to them or to others, such as, for example, members of the public or members of their own families who may be particularly vulnerable or shielding. So how do you deal with this in practice if your employer says to you, so if an employee says to you that that they are concerned about coming back to work? Well, I think that the starting point is to look to your risk assessment, and I know that Emma and Paul will be speaking more about risk assessment, because if you have carried out a risk assessment that has specifically addressed the concerns that the employee is raising, then that may go some way toward reassuring them. If it doesn't, and they're still saying to you, no, I can't come back to work, I'm too concerned about my health and safety, then you could look at alternatives. Obviously, if they're in a role that can be carried out from home, you could look at extending the home working arrangement. You could look at making adjustments, for example, so that they don't have to travel at particularly busy times, or to change the place at which they work if there is a particular office that is quieter or a particular part of the workplace that is quieter. could you do that? But you need to be taking steps to try and reassure them. Because if their belief is reasonable, that their health and safety is, that there's a serious and imminent danger to health and safety, then you cannot take action against them if they don't come back to work. So or if you do, then you are exposed to potentially unlimited damages. And that's obviously what you want to avoid. And to give you an example, there aren't many cases in this area, but there was one case involving some prison officers who refused to travel into work because the road that they had to travel up was a hilly road, very icy and snowy, and they refused to travel on that road because they said it wasn't safe. Some of their colleagues made the journey and actually got into work, but they didn't, and they had their pay docked. And that was found to be a breach of the of Section 44 of the Employment Rights Act because they were reasonable in their belief that travelling along that road would have put them in serious and imminent danger. So that's the position in relation to staff who say that they can't come back to work because of concerns about their health and safety. What about people who can't return because schools and nurseries haven't opened? Well, the government has so far been quite vague about this and has just said that it expects employers to be reasonable. What is reasonable? I mean, I think we're all having to be creative and to come up with new solutions at the moment in terms of the current situation. Flexible working, working from home, working outside, normal working hours. We need to be reasonable. If we're not, and we insist that staff come back to work when the schools are closed and they don't have childcare available, then in extremis, then employees could resign and potentially bring claims of constructive dismissal and or discrimination. So it's all about being reasonable and trying to agree as far as possible what will happen in relation to employees who can't work because the schools are closed. They could be encouraged to use holiday, to take unpaid leave, to take parental leave, for example, a sabbatical. We've heard of staff taking unpaid sabbaticals, or reducing working hours on a temporary basis so that they can do a few hours from home. I think it's about being creative and trying to find a solution that works for your organisation as well as for the staff. Because ultimately, if you're forcing employees to choose between caring for their children and coming into work, then in the vast majority of cases, it will be caring for their children that comes top. So if you're starting to think about getting staff back to work and you've got employees who have been furloughed, then how do you bring them back into work? Well, it's relatively simple. You should, at the time that you furloughed them, have written to them confirming that they were being furloughed, ideally getting their agreement to the furlough as well, because there is a requirement as part of the furlough scheme that you keep records of the furlough arrangement from the letters that you sent to employees confirming furlough for a period of 5 years. So make sure you've got those. Check whether there's anything in the letter that you sent to them when they were furloughed which says how you are going to get them back to work. And otherwise, it's just a question really of writing to them or phoning them initially to say, we'd like you to come back to work on a particular day, and just getting them to acknowledge receipt and ideally to confirm that they will come back. We have come across organisations where staff have been reluctant to return if the reluctance to return is due to the health and safety concerns that I've mentioned previously, then you need to try and reassure them and overcome those concerns. If staff don't want to come back because they're quite enjoying being at home, then you could look at allowing them to take holiday if they want to take holiday, or, as I've said previously, a period of unpaid leave. What happens if you need to change your staffing requirements if you come out of lockdown because you may have an increased requirement for staff, or you may have a reduced requirement for staff, which is, I suspect, much more likely? I think the first stage is to assess what you anticipate staffing requirements will be in the new normal. Build in flexibility if you can, as requirements may change over time, but we don't yet know what the longer-term economic of the pandemic will be, or whether we may need to go into lockdown again. The normal right for employees to make a flexible working request still apply to those who are on furlough and to those coming back from furlough. And this is the right to ask to change the time at which you work, for example, to avoid travelling in rush hour or busy period, to change the number of hours worked, for example, to go from 5 days a week to 3 days a week, and also to change the place of work, such as a request to work from home or at a different one of your locations. So those rights still exist. There isn't an absolute right to have your flexible working request agreed, but and there are in the legislation a number of reasons that you can refuse these requests, which are linked to business needs. But the evidence would suggest that a large number of flexible working requests are agreed, because most of us want to have happy staff, and if somebody is struggling to combine home and work commitments, then taking steps to try and alleviate that is only going to make happier and more motivated staff. We have heard of some employers talking already about allowing staff to work from home indefinitely and actually reducing their office space as a way of cost cutting in the future. You need to be creative in the solutions, particularly in light of the need at present for social distancing at work. Options that you could consider could include shift or staggered working to reduce numbers in the workplace at any one time. This may also enable more people to drive to work if there is less demand on parking spaces at any one time, for example. Changing start and finish times to avoid too many people entering and leaving the building at the same time, working from home, sabbaticals, reducing working hours and pay to share out the work that you have left amongst all of your staff rather than a few is an option. Letting go of agency workers and contractors if you haven't already, using holiday or parental leave, taking unpaid leave and sabbaticals. And obviously one of the alternatives that you may need to consider is redundancy if you cannot sustain your existing workplace. All of these options will need to be implemented by agreement with staff, and some may require consultation with unions or employee representatives as well. Now, one of the questions that came in before the start of the WebEx today was whether it is reasonable to ask employees to sign consent to agree to a particular policy, a health and safety policy, or it could be a policy in relation to wearing PPE or socially distancing in the workplace before allowing them to return. And I actually heard on the news yesterday there was some suggestion that if the Football League resumes playing, then players may be required to sign consent forms before they are allowed to play. My view is that it is reasonable to ask employees to sign consent. And I've worked with employers who have, for example, been asking employees to sign to agree to wear PPE in the workplace. The challenge comes if employees refuse to sign, and what you do then. Now, compliance with health and safety obligations is something that employees have to do as well as employers. It's a shared responsibility for health and safety. And employees also have an obligation to comply with reasonable management instructions. And it does seem to me to be reasonable to ask somebody to sign to agree to safety measures before they come back to work. You would need to take specific advice and think very carefully, however, before you took disciplinary action or withheld pay if somebody refused to sign the health and safety policy before coming back to work. And if you are considering redundancies, two things that you'll need to think about in particular. Firstly, do you need to carry out collective consultation and file an HR1 with the government department? If you are proposing to dismiss 20 or more employees within a 90-day period, then the obligations to carry out collective consultation and to file an HR1 are triggered. And you'll be particularly concerned about filing an HR1 because there's criminal liability if you don't do that. That can have an impact on the timing of the redundancies, because if collective consultation is required, you have to consult for a 30 or a 45-day period before you can then go ahead and implement the redundancies. And so you have to factor that into the timescales. If you're proposing less than 20, then you don't need to think about collective consultation, but just individual consultation with a view to reducing the risk of unfair dismissal claims. Now, there have been some questions raised about whether you can start consultation whilst employees are on furlough, because of the general rule in relation to employees on furlough that they can't carry out any work for you or provide any services or generate any revenue. The government guidance has now been updated, however, to say that whilst on furlough, employees who are union or non-union representatives may carry out their collective consultation duties. So if you want to start collective consultation whilst employees are still furloughed and the reps that you will be consulting with are furloughed, or you need to elect reps from your existing workforce because you don't have any in place at the moment, then you can do that. So you can start consulting now with a view to implementing redundancies sooner rather than later. You don't have to wait until people come back from furlough and are on your payroll. It's also generally thought that you can serve employees notice to terminate their employment whilst they are furloughed. The government guidance isn't specific on this, but just says that furloughed employees have the same rights at work, including the right to receive a redundancy payment. So our view is that you can use the furlough payment to pay people's notice pay, although not a redundancy payment. You'll have to fund that yourself. So that was it from me in relation to the employment law implications of exit strategies and health and safety. I'm going to hand over now to Emma, and then I'll come back at the end if there's any questions that people have which are aimed specifically at me. Thanks, Emma.
Thanks, Kirsty. Good afternoon, everybody. I hope you can all hear me properly. I just wanted to start in relation to this. So I'm just going to do a segment on health and safety. I'm going to do a short overview, and then I'll bring Paul in, who's a health and safety advisor at Stallard Kane, to give some more practical advice about risk assessment. I wanted to start with a little bit of comfort for you all in terms of the fact that health and safety law hasn't changed. It remains the same and imposes the same obligations on employers as before COVID-19 arrived, which essentially requires employers to do everything that's reasonably practicable to protect the health and safety and welfare of its employees and anybody else who may be affected by the business, i.e. customers and visitors to the premises. The key to this, essentially, is the management and control of risks in the workplace, which I'm sure that you're all familiar with at some level or another. I think, however, the challenge now is the new risk from COVID-19. It impacts on all businesses and in all areas of all businesses in a way that was unlikely to have ever been encountered previously. So where are we at now? We've got the recent government guidance, and as a result of that, many businesses are now looking to reopen, preparing to reopen after a period of unprecedented closure. I'm sure many of the businesses have never been closed for this length of time before, certainly not through choice. The government has published 8 separate different documents for now, which all deal with different sectors. However, there is a significant degree of overlap between all of them. The guidance is okay. It has had some criticism, but it does provide a framework, and it has to be sufficiently flexible, really, to identify that even within a specific sector, there will be a wide range of different businesses. So it tries to accommodate that within the flexibility of the framework. And all of the different guidance documents have one thing in common, really. They need businesses to become COVID secure, and the first step in that process is to undertake a COVID-19 risk assessment, and that's something that all businesses need to do, and that's something that we'll focus on a little bit more with Paul later on. What the risk assessment requires you to do is to identify what activity and situation might cause transmission, so identify the hazards within the business, the hazard areas, and identify who could be at risk and how likely they are to be exposed, which is the risks that you're trying to identify and ultimately control. Then you need to take action to remove that hazard where possible, and if you can't do that, then you need to identify measures that can control the risks. And the guidance does recognise that it is impossible to eliminate completely the risk of COVID-19. So the measures are there to mitigate that as much as possible. Sounds relatively simple. However, it's the implementation that is the difficulty, because of the huge scope of the risk areas that you need to look at within a business. The risk assessment needs to be carefully considered. It can't just be pulled off the shelf. It has to be bespoke to your business, and it has to be documented. That's the best protection you have against the HSE if they ever do come in and investigate anything, that you have everything clearly documented as well as implemented. In addition, the risk assessment needs to follow the government guidance, any relevant HSE guidance, and any specific sector or association guidance. So it is a significant undertaking because it does require any business to consider all the different guidance from all the different sources. And unfortunately, on occasion, that guidance does tend to be a little bit inconsistent or not clear. One of the key aspects is to consult with employees, and I think that feeds back into what Kirsty has been saying about bringing those employees back. They must be engaged in the process, they must be kept informed, and they must be consulted. Both legally, there's a requirement to consult, but also it makes sense for a business, because if your employees are not happy, they don't feel safe, and they don't feel engaged in what the business is doing to protect their safety, then that's not going to end well in terms of how that employee behaves, and ultimately what the cost might be if they report their concerns elsewhere to the HSE, for example. And it's key that employees are trained on any new measures that are implemented to ensure that they understand what those new measures are and why they're being implemented specifically. You're much more likely to get engagement, obviously, if you keep them engaged in the process. I think the biggest challenge, and Paul will highlight this in his discussion, is identifying all of the risks that are within the business looking at it's not just the routine areas, it's the non-routine of areas, and that's particularly difficult when the science is changing constantly, the guidance is being updated regularly, and I think one of the key messages from that is that once you've done your risk assessment, that's not the end, that's just the start. You need to then keep it updated regularly and keep it under review, much more often, I would suggest, than an ordinary risk assessment, which probably needs to be reviewed annually or biannually. Here, I think we're talking weekly, certainly a check on the guidance to make sure it hasn't changed in any significant way and that nothing needs to be changed within that assessment. It applies to all aspects of your business, as we said, and I think sometimes it's difficult to see the wood for the trees when you're within that business, to consider all of those areas. Getting to and from work, as has been identified, the travelling to work situation, the toilets, the canteen, the car park deliveries, the entry and exit points. It really is quite a significant undertaking to identify all of the hazards within all of those areas. I think it's generally safe to assume no area is safe from COVID-19 and work on that premise. Paul will go into much more detail shortly about risk assessments. However, before I hand over to him, I just wanted to give you a little short note on the HSE's approach to all of this. So at the outset, when the crisis pandemic was identified, they said they were flexible, they were pragmatic, and they would only undertake a proportionate response to businesses. They recognised the huge challenges that are faced by businesses. However, they've also got a job to do to ensure compliance. And I think they've made it clear within the last week or so that they will take action where they need to. And the government has given them some extra funding to do that, an extra 14 million, 10% of their usual budget increase for new staff, new inspectors, new equipment. And they are going to be making sure that these guidelines are being implemented. I suspect, as a result of the high-profile nature of HSE's role in this, appearing on the daily briefings, that employees are more likely to be aware of the whistleblowing route that they can take to HSE if they feel unsafe in the workplace. So that may well be a route through which investigations are commenced by HSE into businesses. So that's another reason why it's so important, really, to engage with those employees from the outset to ensure that they feel as safe as possible coming to work, and that their employer is taking this seriously and implementing everything that needs to be implemented. So I think to ensure that we keep on the right side of HSE and that you keep your employees safe, Paul's now going to give us some really useful information and tips. He's the one that's been on the ground with those businesses remotely, I think, for the last few weeks, helping them wade through the guidelines, helping them implement these risk assessments. He's a senior health and safety advisor from Stallard Kane, and he's the one that's been on the ground. So just I think to start with, Paul, could you just tell us what you're finding are the biggest challenges being faced by businesses who are trying to reopen?
Thank you, Emma. Yeah, the main issues that we're getting from clients at the moment is, where do we start? It's all about the risk assessment. It's all about the planning. When the Prime Minister made his announcement a week last Sunday, it kind of gives the impression that we're all ready to get up and running again, but there's a lot of confusion about how to do that, what to put in place, how detailed we need to be in these risk assessments and what we have to do. And predominantly the questions that we're getting is either how do we do a risk assessment because it's a new risk, or what control measures have we got to implement. It's probably, when you compare it to something like driving a forklift truck, it's not quite as obvious what the risks are and what control measures you need. But ultimately, it is still a risk assessment, with the hazard being COVID-19, and the control measures are effectively the government guidance. It's the only thing we can use. There's no magic wand. There's no miracle that we know that nobody else knows. We can only follow the guidance, which is based on the scientific evidence. And that's what we've done when we've been helping clients with the risk assessments, which incidentally we've been doing for at least 4 or 5 weeks already. I know the words risk assessments have only been mentioned in press conferences in the last week or so, but we've been working over the last 4 or 5 weeks to get companies up and running. We knew this was coming. Based on the 8 sectors that you've mentioned, that Emma mentioned there, there's a strategy of where we can start, and each stage of the 8 sectors, it all starts with that risk assessment. Just want to cover that in a bit more detail. So we need to ensure we're covering everything, every angle. So we're not just looking at the employees, we're looking at potential contractors coming on site, potential visitors, and obviously for some businesses, we've got members of the public as well. Typical issues that we may have to consider. The employees, we're looking at mental health issues. Obviously, some of these employees will have been off work for several weeks. I know personally, when I've been off on holiday for a couple of weeks, you come back to work and your mind's not quite with it. You're not exactly sure what you want to do and how you want to do it. Times that by 4 or 5, and we could have some issues with employees not quite being sure what to do. The procedures, obviously, we're implementing new procedures. As Emma pointed out and Kirsty pointed out, we need to make sure all the employees are fully understand what these procedures are. Certainly, if you're involving members of the public, I always say you don't know who that member of public is. There may be the safest minded person in the world, or there might be somebody who's more than happy in the last 2 months to go and have picnics in the best mate's back garden. So we've got to make sure the employees know how to treat these members of the public, know what they're doing, know what to say, and so on. For contractors, if we're having contractors on site, we've got to basically go down the hierarchy of control measures. Do we actually need them on site? That's the initial way to look at it. If we can eliminate that problem, if we can put that contractor off for months, 6 weeks, or whatever, that's a possibility. It eliminates the problem. If not, then we follow the guidance. Look at social distancing. If a contractor needs to be in a certain area, can we barrier that off? Visitors, again, whether we're looking at reps coming to try and sell you something, can it be done over the phone, by video message? Can we put any visits off, do them remotely? There's lots of ways we can eliminate that risk without putting other people at risk that aren't part of the business. Moving on from who may be at risk, we are looking at not only the control measures, but how we're going to implement them. So it's very easy to go down the government guidance and say we can put marking on the floor, we can put extra hand sanitizers available for everybody. So the risk assessment really has got to come with a safe system of work as well, or a method statement if you're more used to doing the method statements. And a safe system of work is basically telling how we're going to do it. So the risk assessment will identify the risk and what control measures are needed to be implemented. The method statement or safe system of work will identify how we're going to do that, and that's important to get across to the employees. It'll make them feel a bit more at ease about the company being pragmatic in getting this right from the start. And obviously we want to do this before we open up. We don't want this to be day one as people are coming through the door. Like I said, we've been working on risk assessments. I've been working on risk assessments for several weeks. I've done several risk assessments myself. We must ensure they're suitable and sufficient. So doing a risk assessment may tick a legal box, but if they're not suitable or sufficient, then it won't actually work. A typical risk assessment that we've been implementing, we're looking at between 15 and 20 pages long. So there's a lot to consider. There's a lot of control measures there. Obviously, it will vary depending on the business, but there's a lot of things that we need to consider. Through our own website, we've got a back to business plan, a guide available for everybody. We've also got completed risk assessments that are available on the Style Kane website, which gives you the ideas of certainly the 8 major sectors that the government are trying to get people up and running now, plus a few others as well. we've got all the control measures identified and what we need to implement. Obviously, you need to tailor these to your own business, but it's certainly better than starting from scratch. If you don't want to use Statutory, you can't find any other details, ask your competent person, ask your competent advisor, because they should be able to help you get these things implemented. The other things to consider is, as Emma pointed out, legislation hasn't changed. So again, as Kirsty also mentioned, if we're bringing a reduced number of staff back, we've got to consider things like fire marshals, if they're going to be part of the staff that are coming back, first aiders as well. It's all very well bringing half your staff back, but if the ones that aren't coming back are your recognised first aiders or fire marshals, you could be in breach, so you've got to be a little bit wary of that. And also the welfare regulations. Typically, what we're asking people to do is consider welfare arrangements, so canteens, kitchens, toilets, and obviously you can't just close these. They've still got to be available to comply with the welfare regulations. So it's how you adapt to these different ways of compliance to make sure we're still doing the social distancing, we're still doing the cleaning element side of things. And obviously, as we mentioned, it's the routine work, it's the non-routine work. Don't just think it's about how something initially implemented, your day-to-day running. If you're looking into retail, I know obviously certain retail sectors are coming back to work already. It's not just the shop front, it's also what's happening behind the scenes. It's your offices, your toilets, your kitchens, your changing rooms. If you've got changing rooms for certain retail staff, again, it may be a case of closing these down. It may be a case of having regular cleaning sessions between each visit to the changing rooms. There's a lot of things to consider. Probably too much of a list to go through all in one go. But again, if you contact your competent person, your competent advisor, look on the Statutory website, there's a lot of ideas there that you can use. So that kind of covers the risk assessment element. Every business is expected to do one, COVID-19 risk assessment. Whether you're big, small, 10 employees, 100 employees, everyone's expected to do one. But then obviously you've also got to remember the other areas of the business that are not COVID-19 related. So I wasn't sure if you're going to come in there, Emma. I'll carry on with the other bits. I'll carry on with the other bits. I've got the notes on the other bits to consider. So obviously, when we're coming back to work, if we just push COVID-19 to one side for a second, we don't want to focus everything towards that because the likelihood is there's other things that could slip by the wayside. So it's all about planning, as we've mentioned. As a business, Statutory, we're not doing visits at the moment. We've just started to plan and we're planning 2 weeks ahead. So that's quite typical. A lot of business should be looking at least 2 weeks to implement the risk assessments, the safe system of work, the training, the communication with employees before you start, so you can query and iron out any issues. Typical things that we need to consider are things like the external areas. So obviously, if somewhere has gone unoccupied for a certain length of time, there may be issues with safe access and egress in and out of the building. There may be security issues. As much as we've all been told to stay at home, other people may not have stayed at home and may have paid a visit to your own premises. So we need to check out the security and make sure everything is safe for people before they come back to work. Even things like potential leaks. Obviously, we've had some decent weather over the last few weeks, but if we haven't been able to get into the workplace to check on how well it is or how safe it is, certain things like leaks may have to be addressed before we open up again. The general well-being of the property, things like pest control. obviously, if we haven't been occupied, we could have infestations of pest control. I mean, they need to get pest control companies in to sort things out. Phone, broadband, electrical supply, everything needs checking that it's working before we come back, because it could effectively affect our health and safety of the employees or members of the public when we come back in. Most things may just be a visual check, but you may need to get contractors in to check other things. Things like fire. So make sure your alarm systems are working. Give them all a good check. Obviously, we haven't been doing the routine checks if we haven't been operational. And fire plans. Make sure the fire plans are still valid. If only parts of buildings are opening up, it may reflect in the fact that fire exits aren't available or thoroughfares aren't available. So again, we need to obviously double check that all them are all working and operational. The social distancing of assembly point, I'll be quite honest, even though it's something to consider, if the place goes up in flames, then I think the bigger risk is fire. But again, if we all get out of the building safely, then we can worry about social distancing and doing the roll call at the assembly point. Things like gas and heating, hopefully not so much heating at the moment as the nice weather continues, but do we need gas boiler checks, gas heaters, any gas detection, any carbon monoxide detectors? Again, make sure these are all checked. Lifts and lift-in devices, things like lower inspections, lifting operating, lifting equipment. Have they run out of date since we've been off? I'm going to touch on that with a question that's already come in. Again, we may have to ensure that these things get tested before we can get them up and running. Waste storage is as simple as, our drains working? We don't want to start work and then find out we're flooded out because drains have been blocked. Sanitary areas obviously are the same, and certainly the water storage as well. Most businesses wouldn't necessarily have a Legionella problem, but obviously if we've been shut down for several weeks or in some cases potentially several months, it may need, we need to get a water specialist in to identify if we need water treatments. It may just be a simple case of flushing the systems, making sure there's fresh water everywhere, but again, it's something that we can do before we start work so we don't get caught out. And finally, the machinery and equipment, quite simply, if we haven't been checking it, things may have seized, they may not have been maintained. We need to make sure everything's up and running, all the guarding is still in place, everything, all the safety devices work. All these checks need to be made before everything gets up and running. We come under the pure regs, that's the provision and use of work equipment regulations. So if something's not working, we can't use it. If it's got a safety feature, that's got to be working. Otherwise, we're going to put ourselves at risk if something goes wrong. And generally, the control measures are still the same as the government have been saying. Social distancing, cleaning procedures, they're your two main ones. We'll get them implemented, but we're on a long way of going down the right lines of getting things implemented.
Paul, we've got quite a few questions coming on this in relation to PPE and the confusion that surrounds whether it is or it isn't a control measure. Is there anything that you're saying specifically to businesses in relation to PPE?
Right. So PPE technically is a control measure, but what we want to be doing is looking at the hierarchy of control. So what we've all been doing, hopefully all been doing over the last 8 to 9 weeks, is working from home where we can. And working from home is effectively, we've eliminated the risk in the workplace. So we always look to eliminate the risk if we can. If we can't, and obviously if we're going back to work, then that's not going to be the case. We can't necessarily eliminate that risk. That's when we look at the hierarchy of how we're going to control the risk of COVID-19. So this is where the social distancing comes in. The various procedures that we might implement with hand washing, job rotation, there's various bits that Kirsty picked up on as well, all to eliminate to reduce the risk of contracting COVID-19. The government guidance on PPE as it stands is to only use it in public transport if it's necessary when travelling to and from work, or in confined spaces. And obviously confined spaces may include the workplace, but we are really pushing to social distance. If you can't social distance in the workplace, you really should be questioning whether it's safe to do that particular job, or if it can be done in another way. We don't want to be pushing the PPE in that respect in the risk assessment. And even then, we're talking facial coverings, not facial masks, because obviously we don't want to be taking any PPE away from the NHS or the care workers.
We had a few questions that came in when people were registering, most of which I think are for you, Paul. You're a popular man today. Okay, so we've got a question here. We are a charity that supports numerous families across the UK of children who have complex health needs. Many parents are now being told that they have to come back to work even though their child is on a shielding list. Is it safe for these families to work?
Yeah, I'm glad Kirsty picked up on this one in her segment. It's a very difficult situation because I think if you give any family a choice between looking after the family and going to work because of safety issues, they're going to pick the family. A lot of it comes down to communication. The employee obviously has a right to know exactly what's going on. The employer should be considering what the employee is going through. So if you get the communication going, it's going to depend on the business that the parents are actually working for. It may be a case of changing the work routine, reducing that risk. It may be a HR issue, taking holidays, going on to the furlough system or something like that. But really, it is about communication. Hopefully, we've got some very sympathetic employers there that will be very considerate when it comes to people that have got children to be shielded, and they can work it out between them in the safest possible way.
The next one is hopefully a little bit simpler. Can we use a fire exit as an exit route to assist the one-way flow of the office?
Yeah, so this is one of the things that is in the government guidance when we're talking about segregation, and I know Kirsty picked up on it as well. If we have a lot of people all using certain access egress thoroughfares, a one-way system is not a bad way to go. If it means using a fire exit, then there's no reason why that can't happen. Obviously, we've got to consider the reason it's a fire exit. We've got to make sure it's always accessible. We can't block it in any way. We don't want people standing in the doorway or mingling in that area anyway because of social distancing. But there's absolutely no trouble, no reason why the fire exit can't be used as long as it doesn't interfere with the fire reform order and the fire regulations.
Another question that came in was about statutory inspections. What do you need to do to ensure compliance when contractors refuse to come into properties to carry out statutory inspections? Right.
So this is one of the things that HSE mentioned last week when I was in the government press briefing. So when we're talking the statutory inspections, obviously it's legal compliance. HSE were very clear that that legislation hasn't changed. Obviously, you picked up on it as well, Emma. The HSE, what they're expecting basically is still compliance. They want everything tested as normal. If the business is still closed, they expect businesses to provide the contractors with access to go and do the statutory testing while that business is still closed, which actually probably works out better for the contractor because it means the likelihood is they're going to be able to do the job without any disturbance from anybody else. If that's not possible, if the business is already up and running, then we go to the social distancing. Remember the hierarchy, we can't eliminate it looking at the social distancing. So for certain statutory inspections, it may be a case of clearing an area for the contractors to work, making that very clear to the contractor that you've done your risk assessment, you've got your procedures in place, your employees fully understand and fully aware what is required, giving them the confidence that they can come and do the job safely. If we've got to that stage and we're still struggling and the contractor that is used is effectively too busy doing other safety critical work, maybe working for NHS, care homes, etc., the HSE have slightly relaxed their view by saying as long as the employer has gone down every avenue and made a reasonably good attempt at getting these tests done, and it is recorded, that they will accept that things may be delayed. Well, I wouldn't push that one too far.
That's great, Paul. Thank you. Another question that came through on registration. We deliver physiotherapy to children with additional needs and support for the whole family. Social distancing will be impossible as physios have to be hands-on with the children. We are not planning to return until September at the earliest, and then probably in a phased capacity without the social hall activities. Do you have any advice on how we can safely return safely for our staff, volunteers and families?
Right. So, as with everybody else, we start with the risk assessment. We may have to implement a safe system of work as well. So we identify what we're going to do and how we're going to do it. Now, rightly so, for this particular sector, we can't do the social distancing. This was most likely one of the reasons why it's not in the brackets of companies to get back up and running just now. It's really difficult. The guidance isn't very clear on that. I'm sure more guidance will come out. I think the likelihood is that when we're talking months ahead, so if we're looking at September before we start having to look into this type of work, PPE may be more available, testing may be more available. These will be added to your control measures. And then it's just a case of talking to families, giving them the confidence that you're going to follow additional hygiene routines and making sure they're comfortable with any anxieties they may have.
Thank you. This one, I think, hopefully is relatively simple. Do you think one precaution companies could implement are desk hygiene screens for their staff safety when opening offices?
Yeah, it's an interesting one, this one, because usually it's the office-based companies at the lower end of the risk scale. Yet for COVID-19, it's probably on the higher end of the risk, certainly with open plan offices and the way seating tends to be set out in open plan offices nowadays with people sat opposite each other. Again, when we're looking at the risk assessment, what we want to do is identify who's at risk, how we're going to implement these control measures. If people can still work from home, then obviously we can still utilise that as an elimination measure. If people have to come back to work, we're looking at the different seating arrangements. Yes, having partitions will help, but it comes a little bit lower down. We prefer the social distancing. The partitions may work. If two people need to be sat close to each other, it may be better off that they're back to back or side to side rather than facing each other. But yes, it is a potential measure that can be used, but there are others that would possibly be better to look at first.
Thank you, Paul. That's all the questions that came in on registration. We've had 5 questions come in. I think there might be 1 or 2 for you, Kirsty. Do you want to?
Yes, I'm happy to take the question. So the first question that came in on an employment law perspective was, if people can work at home, should we be, why would they be asked or required to come into work? And that's absolutely the point. The government guidance is still very clear that where people can work from home, they should work from home. If your staff can work from home, then keep them working from home at the moment. The next question that came in from an employment law perspective was about employees who are on reduced hours and how long can employees stay on reduced hours. Employees who are put on reduced hours for 4 weeks, a continuous period of 4 weeks or more, or who, or for a total of 6 weeks in any 13-week period, have the right to claim a statutory redundancy payment. But if they do, but they can only claim a redundancy payment if they terminate their employment. And at the moment, given the job market and the numbers of unemployed, I think it will be a brave employee who decides to leave you and claim a statutory redundancy payment. So if your staff agree to stay on short-term working for longer than 6 weeks, then they can. It all comes down to agreement. They've got the right to leave and claim a redundancy payment if they want, but if they are happy or willing to stay on short-term working agreements, then there is, in theory, no time limit on how long you can keep them on those short-term working agreements. The other question that came in was whether an employer can give an employee who can work at home the option of returning to work in the office. Well, the simple answer to that is at the moment, no. Only key workers are supposed to be going into the office, and it's all workers whose work cannot be done at home. So if work can be done at home, you should not be giving people the option of returning to work in the office at the moment. And we'll have to wait and see how things develop over the next few weeks. And when we get updated government guidance, we can review that.
I think go on.
Sorry, Emma?
I was just going to say, I think the other question was for Paul, but sorry if I interrupted you.
No, Paul, do you want to take the last question and then I'll wrap up?
Yeah, is this the providing face mask, Emma?
No, what measures would we need to take for empty office space with contractors on site to do fit out? Is it the business owner's obligation to carry out risk assessment or contractors? I think you probably have covered that in the last few bits.
Yeah, so control contractors, basically, we want to know, we've still got a duty of care while they're on your own premises. So you need to make sure that they provided you with a suitable risk assessment method statement of what they're going to do, how they're going to do it, and obviously follow the other guidance of everything else other than COVID-19. Make sure they're safe access, egress, make sure they're aware of fire safety issues and procedures and the like. But yeah, make sure you get their details before you allow them on site.
Thanks very much, Paul. So that brings us to the end of the a webinar. If any of you have any questions that come to you after the end of the webinar, please do send them in, and Paul, Emma and I will be happy to answer them. The email address is events@irwinmitchell.com. Thank you very much for attending today, and thank you very much to Paul and Emma for their presentations. We are carrying out these webinars on a weekly basis. We would love to hear what you want us to cover, so please do get in touch if there are any specific issues that you would like us to cover in a future webinar. We also have a huge amount of information available on our website. We have a coronavirus hub, which covers all things legal and financial relating to the COVID-19 pandemic. The session today has been recorded, and you will be sent a link so you can listen to it again if you would like to. And I think that with 1 minute to go, that leaves me just to say goodbye, and thank you very much for attending today. I hope you found it useful.